I'm Richard Rosenfeld, a distinguished professor at SUNY Downstate Medical Center, and here's my brief talk on how to tell if a medical treatment really works. So modern medicine is replete with medical treatments. Some are surgical, some may be drugs, there's complementary alternative, holistic treatments, and the advice is ubiquitous. It comes from everywhere. It comes from doctors, other health professionals, from friends, from relatives. You get it on television, from the media, from the latest doctor expert on TV. But how do you know if this advice is worth taking? How do you know if a treatment really works before you take it? Well, this is an important question because every treatment has an upside and a downside. And the downside could be serious, not the least of which is something called an opportunity cost. When you take a certain treatment, what you're basically doing is foregoing other options. So if you use a treatment that is ineffective or harmful, you're missing the opportunity to use effective treatments. So we really need to sort this out. So to sort it out, let's take a trip in history. We're going 1895, Vienna, Austria, a lovely place, where a medical luminary called Sigmund Freud is practicing. And Sigmund Freud sees a lot of patients with painful menstruation, dysmenorrhea. And he's referring these patients to his friend and colleague, Wilhelm Fleiss, who's an ear, nose, and throat doctor. And Fleiss has some interesting thoughts about this. He believes there's a connection between the nose and menstruation and reproductive symptoms in general. Now, why would he think this? Well, it turns out for more than 2,000 years in Greek and Roman writings, there's reference to nasosexual medicine. It's nothing new. What did change in the later half of the 19th century, though, about 1890, was a fellow named Morrell Mackenzie, an ear, nose, and throat doctor, noticed, looking under the microscope, that there's only two places in your body with erectile tissue, tissue that can swell up. And guess what? It's the nose, the bones of the nose, also called the turbinates, and your genitals. Same exact tissue under the microscope, therefore must be a relationship. So what did Fleiss do, this ear, nose, and throat doctor? He decided to cauterize the nasal bones of women with painful periods. And according to him, it worked well. So he took it to the next level. He began chopping out, cutting out the nasal bones, called turbinectomy, removing these bones that normally warm and humidify the air when you breathe, and again claimed the women did very well. And these observations were enthusiastically seconded by Sigmund Freud, who kept sending him patients and backing up his claims of efficacy. So this wasn't just a product of two folks. This idea caught on. And about 20 years later, in 1914, an article was published in the prestigious Journal of the American Medical Association of 93 women with dysmenorrhea, painful periods, all of whom had nasal surgery. And this nasal surgery allegedly cured them of their painful periods. For the next 30 years, in textbooks of gynecology into the 1940s, this idea of a nasogenital connection, nasogenital reflex, persisted, even to the point that some people suggested if a woman had chronic nasal symptoms, they could operate and remove something down below to cure that. Thank goodness that never happened. So this story prompts two questions to you as the listener. First, how could such smart people, such luminaries of their time, do such silly things that are so bizarre and foolish in retrospect? And here's the important one, here's the kicker. How do you know that next time you are recommended a treatment by someone, that 10, 20, 40, 50 years from now, people won't look back and say, oh my gosh, what a bizarre and foolish treatment. How could they possibly have recommended that? Well, that's the conundrum. We don't have a crystal ball. So what can we do to know now if medical treatments you're taking at the moment are effective or not? So, first part, how can authorities be so foolish? Well, there's a saying by Richard Feynman, a physicist, very applicable. Science is a belief in the ignorance of experts. The ignorance of experts. So even luminaries can be very ignorant. And in this case, I think we can agree that Freud and Fleiss were probably pretty ignorant in retrospect. So we need to advance science by being very critical. And when we hear about a treatment, we have to ask two questions. First, if someone's getting better, how much of it is because of the treatment? And second, how much of it would have happened anyway? Things happen anyway, with or without a medical encounter. If you think about roosters, for example, any of you grew up on a farm, you talk to any self-respecting rooster, and they will tell you flat out, with no uncertainty, that roosters make the sunrise every day. Now, clearly, roosters don't make the sunrise. The sun would come up if the rooster slept late or never crowed or, walked away. But the roosters think it's them. So the issue here is confusing a temporal relationship, something that happens in time, versus a causative relationship, something that happens because we do something. And in medicine, things can happen on their own. You can get a treatment and you could get better, nothing to do with the treatment effect. For example, there's natural history. Lots of things run their course. Viral illness, bacterial illness, most sinus infections, ear infections, throat infections, lots of other things, even urinary tract infections, strep throat. Lots of this will get better on its own if you just give it time. Your immune system fights it, etc. There's spontaneous resolution. Things just go away. Unpredictable. And finally, there's something called regression to a mean. Regression to a mean sounds complicated, but it's simple. People with non-serious conditions that fluctuate tend to seek medical care when they're sick. And no matter what happens next, they tend to fluctuate and return to a mean state. A little time passes, they feel bad again, they see the doctor or the therapist, and then they regress again to the mean. So we need to figure out what's due to treatment and what's due to these other things that would happen anyway. So how do you figure that out? Well, we need to think about two things here. The first is in 1747. We're going to take a trip back in time where a fellow named James Lind. James Lind was a very smart doctor in the Scottish Navy in 1747, and the big problem then was a lot of sailors were dying of scurvy. Scurvy is a vitamin C deficiency. They didn't know that at the time. It would cause the sailors to become very weak, fatigued, severe muscle aches. They'd get ulcers and rashes and problems around their mouth. They'd get anemia, and they'd eventually die. Very serious. No one had a cure. Well, James Lind had some ideas, but he's a pioneer because he did the first comparative study in medicine. And that's how we tell if something works, by comparing it to alternatives. So what did he do? He took 12 sailors with scurvy, all of whom had roughly the same level of disease. He put them in the same part of the ship to control for that and gave them the same diet. The first 6, he gave the standard treatments that were used by the Navy, different types of acid. So they had acetic acid, they had cider, they had a sulfuric acid treatment. The next 2 patients, he gave lemons and oranges. The next one, he gave a popular treatment, drinking lots of seawater. And the final group received some herbs, which were popular as well. So what happened? The group that got the lemons and oranges did beautifully. They were cured of their scurvy. He then gave the lemon and oranges to the remaining 10 people, and they were also cured. So it looked like the lemons and oranges worked, and we know this because comparing them to the other things, they did very well. We need a comparison. But this isn't perfect. There's another problem that comes up here. What if James Lind knew in advance that he really wanted the lemons and oranges to be the best? He might have rigged the system. He might have picked the least sick patients and gave them the lemon and oranges. Maybe he put them in the best part of the ship. Maybe when he judged how they were doing, he was very optimistic and rated them better than they were. There's lots of ways that he could game the system or some bias could creep in. So to deal with that, we have to now jump to 1931, not that long ago, when the first randomized controlled trial was done in medicine. Very important. Tuberculosis was fairly rampant at the time. Antibiotics had not been invented to control it. And the popular treatment was injections of gold and sulfa. Very painful, but allegedly worked. So in 1931, a very nice study was published in a leading medical journal where they took 34 patients, a little more, I think 40 patients, and they treated them all with these standard injections of sulfa and gold. And according to the authors, they had excellent clinical results. In the same issue of the journal, the same exact time, was published another study, the first randomized trial in medicine, where the authors were very clever. They took 24 patients with tuberculosis, 12 of whom they gave the gold and sulfa therapy, and the other 12 they injected with saline as a control. Now, the patients didn't know what they were getting because they flipped a coin to determine who got what. And lo and behold, there was no difference between the groups. They did exactly the same. The only difference was that the treatment group, the ones who received the sulfa and the gold, had terrible side effects, toxicity. They had liver and kidney damage. Suffice to say, this was the death knell for gold therapy in the US for tuberculosis, and the treatment stopped. Okay, so let's go back to you and your quest to know if something works. To do that, we need to return to our patient of Dr. Freud. Her name was Emma Eckstein. She was an Austrian writer who had severe menstrual cramps and some associated depression, saw Freud, who diagnosed her as having a reflex nasal neurosis, promptly sent her in 1895 to see his friend and colleague, Dr. Fleiss, the ear, nose, and throat doctor. And by the way, Dr. Fleiss also did plenty of surgery on Dr. Freud himself. Freud had all sorts of nasal conditions for which Fleiss allegedly did some surgery and helped. So Fleiss treats Emma Eckstein with this surgery called turbinectomy. He removes the nasal bones and allegedly gets a very good result. Unfortunately, Miss Eckstein didn't agree, and she returns a few weeks later with a severe infection in the nose. It turns out that Dr. Fleiss, in his enthusiasm for the surgery, forgot to remove about 18 inches of gauze from the nasal cavity. It was still in there and horribly infected. So he removes the gauze, and then Emma promptly proceeds to hemorrhage from the nose, almost dies of a fatal hemorrhage, does survive, but is unfortunately disfigured. Her face is all collapsed on one side. Freud, however, believes that Fleiss did everything right. This was all Emma's fault. It was a hysterical reaction, Freud claimed. Emma, interestingly enough, goes on to become the first woman psychoanalyst in history. Go think, go explain that one. Anyway, now, that was a terrible outcome. You don't want that outcome. Absolutely not. So what are the questions you need to ask your doctor? Well, first, you want to ask your doctor, what are the side effects of a treatment that's being recommended? You know, are they serious? For example, nasal infection. That was serious. Antibiotics weren't invented till 40 years later, so that could have been fatal. You know, a second question is, how do I know your treatment is better than what would happen anyway? Better than natural history, better than spontaneous resolution, better than my ability to fight this illness? Well, the way you know is you ask, are there any controlled studies? Have controlled studies been done where this treatment is compared to others in a meaningful way? And are those studies actually published in reputable journals? If they are there randomized controlled trials where people don't just get different treatments, but they randomly get assigned to them so we don't let the bias, the subjectivity of the investigators get in the way of our interpretation? And last, and perhaps most important, is to ask the person recommending a treatment, do you have a stake in this? Do you make money from recommending this treatment? Do you base your reputation on it? I'm sure that Dr. Fleiss got paid very well for his nasal surgery, and he does seem to have built a reputation on it. So is he going to really be objective when his reputation and livelihood are based on a surgery? No. So ask the right question, please, treatment skeptic, and most importantly, do not be the next Emma Eckstein. Thank you.